Hi all, welcome to the Premom YouTube channel. I am Nurse Linda and I am here to talk with you guys today about something I just felt like I wanted to get out and teach you guys because I want you to understand as much about what's going on with you and your body as I do. I mean, you should, right? So you guys know we started an IUI component on the Premom app. And by the way, please, down below, you can subscribe. I'm going to be doing more of these videos. I don't want you guys to miss out. The more you understand, the less stressed you are about things. And so that's what this is about. Anyway, so we added this IUI component to the Premom app. And it is like so popular, like gangbusters. You guys are coming in and using it. And I am like thrilled with that because these are things that are going to help you. Absolutely. Now, so I wanted to talk about something that comes up a lot regarding IUIs, intrauterine inseminations. These are the kind of inseminations that you go to a clinic to get done. These are not the inseminations that you do at home. You can't do an insemination inside the uterus at home because you have to prep the sperm a very special way, and that can't be done at home. But you can do intracervical inseminations at home, which is basically like, you know, when a guy ejaculates type thing inside. You can put sperm inside you as well. Now, so we're focusing on intrauterine inseminations. Now, basically, there are two types, if you will. There's what's some call natural IUI. I like to refer to it as non-medicated IUI because to me, it's kind of like the childbirth issue, right? It's all natural childbirth. I don't care if you had a C-section or an epidural or what have you. It's all natural. So I'm going to say there are non-medicated IUIs where you just let yourself ovulate and you get an IUI. Or there are medicated IUIs, and I'm focusing on the oral medications like Clomid or Letrozole. Now, the point of this video is to talk about what is best when it comes to an LH surge or a trigger shot. What's the best thing? You hear all kinds of reasons for each. And I mean, it got to the point that I was, not sure about what was going to be best here either. So I went out and did some research. And the research I did was watching a lot of videos, learning a lot, reminding myself what I already know and having things fall into place. And there's a physician out there, a Canadian physician. His name is Dr. Victory. And down below, you're going to see, we're going to put some links to a couple of his videos specifically that I watched and really learned and understood and agree with about what's the best way to trigger, have an LH surge to bring yourself to ovulate when you're going to do an insemination. Now, the first video that I watched of his was about the non-medicated IUIs. And he came out with a couple of statistics that were very interesting. First, he had said, if you do a natural IUI, unmedicated, you're just letting yourself, ovulate normally, the 1 egg you do every month. But of course, oftentimes because you're getting the insemination in the clinic, they're going to do an ultrasound on you. They're going to watch to see, if your follicles gotten big enough. Usually follicles are around 18 to 20 millimeters when they're at their peak in size before you ovulate. And then often clinics will do HCG trigger shots like Ovidrel or HCG 10,000 IUs. They'll do a medicated trigger shot to make you ovulate. And you might ask yourself, why? I mean, I ovulate each month. I'm here getting an IUI for some other reason, but I ovulate. Why am I doing this trigger shot? Well, oftentimes trigger shots also help a clinic with timing, so it works for them. Or you certainly would have a choice in an insemination cycle, an IUI cycle, to just do your LH test kits like you always do and letting them know when you have your LH surge. Those are basically your two choices, right? When you're doing an IUI. Here's what Dr. Victory found. If you do an unmedicated IUI and you do an HCG trigger shot like Alvedrel or what have you, an injection to time your ovulation, you have about a 10.7%. And we're going to post these statistics here on the screen because I want you to see them. You've got about a 10.7% chance of pregnancy when you're using the trigger shot in a non-medicated IUI. Alternatively, if you just allow yourself to ovulate naturally, you know you do this all the time. You're doing your LH urine strips a couple of times a day. You're waiting to get your peak. You know, that means LH surge, not a high. I'm waiting for that peak. If you time the IUI based off of your own natural LH surge, do you know what the pregnancy rate jumped up to? 22.7%. Look at that. 10.7% versus 22.7%. So in this case, with a non-medicated IUI, you had more than double a chance of success of getting pregnant by letting yourself have your own LH surge. Now, you know, I like you guys to understand why. That's a great statistic, and I love that. But I want you guys to understand why that is the case. And here's the reason. I mentioned a minute ago that your body grows this follicle till it's about 18 to 22 millimeters. And as this follicle gets bigger and bigger and bigger, it is producing estrogen. The bigger it gets, the more estrogen it produces. Now, when that follicle gets to its, let's just say its mature size, whatever that might be, it's a little different for everybody. You will now have your highest estrogen level because your follicle's at its biggest size. And that estrogen is sending signals to your pituitary. That's where LH is released from. So that estrogen lets your pituitary know, hey, up there, we're ready to ovulate, follicle's good to go. And you have an LH surge. It's your body talking to itself. Your body knows what it's doing. Now, what does HCG do? Well, what happens in this clinical setting, of course, is the docs do an ultrasound and they say, okay, Susie, your follicle is 18 millimeters. You're ready for your trigger shot. So they have you take the trigger shot sometime that day, and then they'll have you come in tomorrow, let's say, for an insemination for your IUI, because the HCG trigger shot will make you ovulate the next day. Now, that's what it does, because HCG acts and looks like the hormone LH. So it makes you ovulate. But what if that wasn't as big as your follicle was going to get? They triggered you at 18, but maybe your best egg was going to come out when the follicle got a little bigger at 20. Maybe. Well, the docs don't know that. They don't know what is the best size for this particular egg in this particular month. But you know who does know? Your body knows. Don't doubt the power of your body. So that's why the natural LH surge does such a better job, because it will only have a surge when it knows your ovary is ready to release that egg. And how does it know? Because your ovary told it. No guessing here. There's no convenient for the clinic. This is what's best for you in your cycle. For those of you doing non-medicated IUIs, and trust me when I tell you, you could get a little bit of resistance when you maybe strongly suggest to your doctor how you'd like to do this cycle. But it is your cycle. At the end of the day, this means everything to you. And quite honestly, oftentimes you're just another patient in their day. So you have got to remember, you're not here to make friends. okay? You're here to get yourself a baby. So you've got to stand up for yourself. But you know, when you're having a non-medicated IUI, I want you to do that. And I want you to understand going with your LH surge is the way to go. Okay. Next topic is, what if you're doing, and most of you are doing this, and that's the medicated IUIs. You're using Clomid or Letrozole. It's what most of you do. Mostly because, well, there's a practical reason for some of you, because you won't ovulate without it. Welcome to my club, right? You need help to ovulate, so you have to take it. And then there's also a lot of you who do ovulate on your own, but the doc will generally prescribe it, because the truth is the pregnancy rate is a little bit higher in a medicated IUI, simply because you tend to super ovulate. What that means is you usually will, instead of just one follicle or one egg, you might have two or maybe even three. Now, of course, that comes with the risk, is if you get pregnant, you could get pregnant with twins. You know, usually it's not more than that, but it can happen. But so everybody wants a little bit of a higher chance. So again, the medicated IUIs with Clomid or Letrozole, oral pills you take for about 5 days, and they will usually bring on ovulation for you. Okay, now what about in these cycles? What should we be doing? Well, Dr. Victory, that would be his second video I watched, went on to explain. I love the way he explains this. It made it really easy for me to understand. He went on to explain, again, they did a retrospective study of like looked at hundreds of cases. And when you're doing a medicated IUI, they found, and again, I'm going to throw out these pregnancy rates for you, and they're going to be here on the screen. The pregnancy rate, when you're doing a medicated IUI and you just let your body have a natural LH surge, was only 5.8%. It was pretty low. I'm going to explain why in a minute. All right, what about if you did the HCG trigger shot? The pregnancy rate went up to 18.2%. What? Wait a minute. Didn't I just tell you about a minute ago how the natural LH? Yes, I did. And I'm going to explain this. But it's here on the screen. I want you to see it, because I want you to understand. And lastly, there's a third choice here that they looked at in this study. What if you did both? What if you did your LH urine strips, you know, every day, twice a day, looking for your, you know, peak, but you also allowed the doc to prescribe the HCG trigger shot like Ovidrel or what have you? That pregnancy rate, are you ready for this? That pregnancy rate, 30.8%. Are you guys seeing this here? Let me say this again. Pregnancy rate with just your LH surge was 5.8%. If you did just the HCG trigger shot, went up to 18.2%. And lastly, if you did a combination of the two, you did your LH surge testing and you let the doctor prescribe for you your HCG trigger when you have your LH surge, pregnancy rate went up to 30.8%. Now that's nuts. I'll take that any day. Now let me explain why. A lot of people saw these studies, they watched these videos, they said, hey, this guy is contradicting himself here. He said one thing on one video and another thing on another video. No, he didn't. I know it did sound like that initially, but that's not what he said. Let me explain. Now, remember I mentioned a minute ago, what does your follicle, as it gets bigger and bigger and bigger, what does that follicle produce? Estrogen, right? Okay. Now, I also said a minute ago, sometimes you might super ovulate when you're taking Clomid or Letrozole. What did that mean? Remember, you might grow 2, maybe 3 follicles. So now in this situation, I've got 2 or 3 follicles growing, let's say 2, and both of them are producing estrogen. Okay, now my body is used, let's just say my usual peak estrogen is 200 when I'm ready to ovulate. Well, my pituitary, it doesn't know exactly how much or how many follicles are producing the estrogen. It's just reacting to the amount of estrogen in your blood. Well, you can imagine if you're growing 2 follicles, your estrogen is higher. So imagine this. You might have 2 follicles, let's say around 15 millimeters. Now that's small. I said you normally ovulate maybe when your follicles are around 20 millimeters. But let's say you've got 2 follicles at 15, but guess what? Together, they produce that 200 of estrogen. So if I just leave it to your body to ovulate, it's going to ovulate early because your pituitary is going to get wind of that 200 too soon, and you're going to ovulate. And those eggs aren't fully mature yet. That's why LH alone, when you take oral medications, isn't ideal. It's the lowest. Okay. Now, what about an HCG trigger shot? Well, besides causing you to ovulate, HCG also will mature up follicles. Okay, so that's why HCG in a medicated cycle becomes much more important, because it also has the ability to mature up. That becomes important in a cycle where you might have 2 follicles. And finally, when I combine my body deciding, because remember, I don't know exactly how much estrogen any follicle is putting out. I'm trying to use the best of both worlds here. And when I'm on a medicated IUI, I want to do the LH surge because my body knows best. There's no doubt about that. But there's a flaw when it's got 2 follicles growing because it's not used to that. I like my HCG trigger in this case because it will do a final maturation on these eggs. Because again, I'm in a situation that's a little bit different. So what do? I combine my natural LH surge with an HCG trigger shot, and boom, pregnancy rates up over 30%. You just don't get better than that. And I want each one of you to be in charge of that for your IUI cycles. Again, we've got so many of you coming in now because of the new IUI portion of our app, and I'm thrilled with that. But I want you guys to understand more about everything, but especially now about your IUI cycles. Okay. Thank you for joining me. Thank you for sitting and listening to me. You know, I'm always over in Ask an Expert. You guys are welcome to come on over there if you have any follow-up questions. You want me to look at your charts, any of that, you know, I'm always there for you. All right. You know, I got my webinars I do every week as well. Kristen will always put out what time they are. But I am here for you guys. Premom is here for you guys. I want you to truly understand and believe that. All right. Good luck, my friends. I love you. Bye-bye.